If you were to survey the average dentist or office manager on their top 5 sources of stress, in most of their surveys you're going to find cancellations and no-shows will make it into that top 5. Cancellations and no-shows have always been a problem in dentistry, but there were ways to manage it. But what we've been finding lately, especially with newer clients, it is a much bigger problem than it was 10 or 20 years ago. So we looked into it and figured out why, and we also figured out how to fix it. And that's what we're going to talk about in this week's tip. So what's the number one way to avoid cancellations and no-shows? I mean, sure, it may have to do with how you schedule the appointment or who you schedule it with, if it's somebody who has a history of no-showing. But for the most part, if you were to ask anybody, how do you handle this, it has to do with your confirmations process. And that's where we found the major changes, especially with these newer clients, that we then had them fix, which then increased their show rate. But this is where we found the major changes have occurred over the last 20 years. So to understand that, let me walk you through how the process used to work maybe 20 or 30 years ago. Let's talk about hygiene for a second. So if I was on your hygiene schedule, say I'd come in, let's say I'm on a 6-month recall. I come in, I'd finish my appointment, I'd go up front, I'd check out. As I'm checking out and scheduling my next visit 6 months from now, you would give me a postcard. I would fill the postcard out with my appointment date on it, and I would hand it back to whoever's checking me out, and they would put it in a card file for the month that I'm due. So let's say this is July and I'm due in January. That goes into the January of next year file, okay? So then I leave. A month before my appointment in December of this year, because my appointment's in January, let's say it's January 17th at 2 p.m. A month before my appointment, maybe on December 2nd or 3rd, someone's going to pull all the patients scheduled for January out, the postcards, put stamps on them, and drop them in the mail. So by January 4th, 5th, or 6th, I'm getting a postcard in the mail written by me saying I'm scheduled for January 17th at 2 p.m. I mean, I'm going to notice my handwriting too. I thought it was ingenious, whoever came up with this idea. So now in most cases, if I know immediately I'm not going to make that appointment, I would call you, because I didn't have text or email back then. I would just call, or it wasn't widely used. We had email, but not everybody used it. I would call you, hey, I can't make it, in which case you got a month to reschedule me. This is easy. You got a month to fill that opening you have now. Or I might do nothing. Well, 2 weeks go by, 2 weeks before my appointment. So January 3rd now, you're back in the practice after the new year. I'm due on the 17th. That's when I'm scheduled. I now get a reminder phone call. Hey, Jeff, we have you scheduled on January 17th at 2 p.m. Now, let's say I pick up and I go, great, I'll be there, cool. Let's say you don't reach me, fine. Either way, you left me a message, I've been sent a postcard and given a reminder call. When did the confirmation calls begin? They began 3 days before my appointment. So on January 14th, I'd get a phone call. Hey, Jeff, we're calling to confirm your appointment on January 17th at 2 p.m. Now, if I confirmed at that point verbally with whoever was calling me, great, I'm confirmed, right? Let's say you didn't reach me, you left a message. Well, you're gonna call me now 2 days before. And if you don't reach me, you're gonna leave a message. And then you're gonna call me the day before. Now, if you call me the day before and I still have not confirmed or called you to reschedule, what are you going to do? You're going to tell me basically if I don't call the if I don't call the practice back by whatever time you said, it might be 1:30 where you want me to call back by, then you're going to have to fill that appointment with another patient. In other words, I lose my appointment. So then, a worst case scenario, you have approximately 24 hours notice that you're gonna have to fill this slot if I don't call you back by 1:30. You're giving yourself some time to make sure you can fill that opening. Because even if you do everything right with relation to confirmations too, you're still gonna have the occasional cancellation and no-show. But this eliminated a lot of them. What it didn't eliminate is somebody who had a family emergency and they had a morning appointment and they call you the morning of. That didn't eliminate that. That just happens still. That always is gonna happen, right? But that, for the most part, kept cancellations and no-shows, if you followed that process, pretty well under control. Well, now we have the advent of technology. We have different types of patient management software, okay? Or whatever, patient communication software, things like Addit or Weave or CareCrew, which, let me just be clear, I love these things. I think these things are awesome. but I want you to keep in mind they are a tool, just like a hammer or a screwdriver or a wrench. And a tool has a very specific use and purpose. When you misuse a tool, it doesn't get the job done. And what we've been finding, and this is what we found sort of at the root of these cancellations and no-shows, is people are using these tools exclusively and dropping all human contact exclusively. Meaning, instead of calling a new patient to confirm them, I'm sending them a text. I mean, I spent a lot of money to get that new patient to call my practice. I don't want it handled by text. I've seen it bleed into implant funnel responses for consultations. Someone is just texting people who responded to the implant funnel. They're not calling them at all. And they're wondering why patients aren't showing up. Or the doctor has a large procedure on the schedule 2 days from now. And no one's calling this person. They're just texting these people. You see? And when the person says Y or C, they're taking that as a confirmation, okay? Which to me is a lot different than if you actually talk to the person. And just as a point, it's a lot easier to blow off a text message or put Y or C than to actually talk to somebody and tell them, yes, I'm coming. As a matter of fact, and I would orient my staff to this paradigm a little bit. Number one, if you have somebody scheduling, they should not be thinking whether they scheduled somebody or confirmed people. Yes, those are obvious important steps, but the most important thing is that the person is there. Because very often, you have a person no-show who was confirmed. You go to the person at the front, you go, hey, this person no-showed. Well, they were confirmed. They said Y on their text message. I would want just a little bit more. I would want a little bit more. So here's what we recommend that you do, because what's happened in those cases, especially with these offices that were extreme, where it was just all text and email, is I would recommend a hybrid approach, okay, a hybrid approach. The first thing you're gonna wanna do, let's talk about patients of record for a second, is you should have some way of setting up communication preferences for various patients. You might have somebody who runs everything on a calendar and all they need is a text message and they say why and they always show up. Good, then keep texting those people. Because if you keep calling them, they're just going to get annoyed. Everybody else who isn't like that and new patients get phone calls. You might want to mix the two, or phone calls and texts. So 4 weeks out, I'm getting a postcard. I love that. And I'm getting a text or an email. Hey, we have you down 4 weeks from now. And then 2 weeks out, I'm getting my reminder text or email and my reminder phone call. Okay, cool. 3 days before I get my text, and let's say I'm one of those folks who just always confirms, I just click, I say why, you don't call me because communication preference was wise, you know I'm gonna show up. If I'm not one of those people, you're calling me just like I explained. And here's the point. You might say, Jeff, I don't have time to make all these confirmation calls. Well, I'm gonna give you two answers to that. First one is, if you don't have time to confirm everybody verbally, the ones that do need to be confirmed verbally, then you can prioritize. You can start with, productive appointments, new patients, and then hygiene patients, okay? We could start with that. But the other thing I'd point out is if you're having to handle 3 no-shows or 3 cancellations, last-minute cancellations because your confirmation process is broken, that's a lot more labor-intensive and chaotic than spending 3 days before on the phone trying to confirm people. I would much rather know 2 days before I have an opening than the day of because, I wanted to do everything via text, you see? So here's what I'd recommend that you do. Take a hybrid approach, sit down with your office manager, maybe you have somebody in the practice who's very good at scheduling, work out what your policy for confirmations is going to be based on what you have seen work, and then, and you go back in time to what's worked before. Maybe what you're doing now isn't working as good as what you were doing 10 years ago. Do a nice hybrid with all the technology that you have now. Develop your confirmation policy so that you can increase the show rate in your practice. And to that end, I have some of the confirmation issues I was bringing up, the confirmation policies. I have a handout on this. It's from our schedule coordinator training course on DDS success. The handout is available as a free download below if you want to check it out. Otherwise, folks, that's all I have for you this week. I do hope that helps. Kind of an interesting subject because obviously if people don't show up, things don't work out as well as we'd hope they do. And if you want to find out more about MGE, you can check us out at mgeonline.com or call us at 800-640-1140. And if you'd like to see more tips like this, even shorter ones than this, I realize this one got a bit long, you can click subscribe on the button below and don't forget to hit the notification bell so you're informed as these tips come out. Folks, have a great week and we'll see you at the next tip.